Some 660,000 people have died so far from COVID-19, according to official statistics. Poor, rich, young, old, famous, the virus doesn't discriminate. Even carers, doctors and nurses who were there to help have succumbed to the illness. France and Spain are among the few countries that held public memorials to honor the dead and whose departure has been especially difficult for loved ones. Many have not had an opportunity to say goodbye, and thousands have been buried in mass graves. COVID-19 was unexpected and fast, changing our lives and the world. How do you grieve when bedside visits and funerals are banned? Welcome to your COVID-19 special here on DW News. I'm Monika Jones in Berlin. Good to have you with us. Well, normally we're here to talk about the latest vaccine studies or various other approaches to treat COVID-19. But we shouldn't forget that the coronavirus also kills. And so today we want to talk about death in times of a pandemic. First, a report from the US.
For Amanda and Gina, their grandfather Jose was like a father to them. He taught them everything, helped them become who they are, and died of the coronavirus, one of so many in Arizona.
It was horrible to leave him alone, and him knowing we had to leave him alone. Like, what was he going through at that time? Knowing that he couldn't have his loved ones there to support him. He was facing everything pretty much alone, and there was nothing we could do about it. I don't know, it's heartbreaking. Very heartbreaking.
A situation El Asta has become all too familiar with. Even after 38 years in the funeral business, with the corona pandemic, nothing is as it used to be.
With these families, so many of them haven't been able to be with their loved one at the time of death, put into a hospital where they can't visit, or into a nursing home where they can no longer see them. So many people are dying alone. And that emotionally is challenging for families. Just to know that they can't be there and they can't, be supportive. And so our challenge, our job is to help them kind of deal with that and start to help them heal and grieve. And that's what we do.
More than 2,500 people have already died in Arizona, leaving many hospitals overwhelmed with the sick and the dead.
When we get a death call, the hospital will say, can you come quickly because we're at capacity. We don't have anywhere to put these people. They're trying not to get to these mobile units, but they actually are. So when we go now to a hospital and transfer someone in our care, they have to look and see where the body is. Is it in the hospital facility or is it out in the mobile facility?
It's been a little over a week since they buried their grandfather. Amanda and Gina still need time to come to terms with their loss. But they already have strong feelings about who is to blame.
They could have handled it a lot better, I feel. They knew about this from jump and they did nothing. I understand probably so the world wouldn't go in panic mode, but at the same time, look what's going on. Look what occurred due to them knowing and not doing anything about it. And I really do feel they could have did a lot more to help a lot of people, and people are still getting sick. People are still going to the hospital. People are still dying, and I don't understand why. I just don't. And I don't think it's fair to any of us.
Their feelings are shared by many mourners in America, that the lack of leadership from the White House is just as dangerous as the virus itself.
So let's talk a bit more about death. Lidia Jimenez-Jort is Associate Professor at the Department of Psychiatry and Forensic Medicine at the Autonomous University of Barcelona, and she's also been part of a research team looking into the death and mourning process in the times of the coronavirus pandemic. Good to have you with us. Let me start with an assumption. Western society tends to ignore the fact that we're mortal. Has the pandemic changed that?
Yes. Yes, definitely. This taboo of death also means that we are postponing thinking about death until it arrives. But this helps us to make things of daily life easier. But now the pandemic is forcing a change in our consciousness of our frailty as a humans or as a society. And those that have been closer to someone affected by COVID, they already have experienced this change. And those that are young or feel invincible still persist in this taboo. Unfortunately, we have a new challenge that is to look at health in first person.
Exactly. And of course, I mean, those who've experienced it, and we've just seen that also in the report, many couldn't say goodbye to their dying relatives. They couldn't even give them a proper burial. How big a trauma is that, and how do you recover from that?
Well, first we should say that, like it happens in an accident, nobody expected that the relative will be infected and will die. And similarly to a war or a disaster, the impossibility to say goodbye or to do a ritual disrupts the start of the mourning process and intensifies the following steps of anger, guilt, sadness, and makes the grief worse to be handled. Recovery depends on many factors, and those who have low resilience or low social support probably will need professional help. Searching meaning in life and the purpose of life can make a difference in these situations.
Indeed, and especially as this pandemic isn't over yet, and it has already claimed hundreds of thousands of lives. Professor, please stick around, because we would just like to take a look at some numbers here. This curve that we see now shows just how many lives were lost within a relatively short period of time. It started slowly, but then by mid-February, it became clear that we do have a problem. And by April, we counted tens of thousands who died of COVID-19. Some 6 months into the pandemic, some 660,000 people lost their lives, with the highest death toll in the United States, followed by Brazil, Britain, Mexico and Italy. And as I mentioned, and as we all know, the pandemic is still ongoing. Back to Professor Jimenez Hjort in Barcelona. Please tell me, we're talking about statistics here, but these are people, these were lives lost. Why don't we see more public ceremony mournings the death?
Well, probably because these social expressions of sympathy and grief as a collective always come at the end of the tragedy of the others. Here, we are conscious that we are all one world together in the middle of this battle, still in the battle, it's not yet over. And also because there are other countries that are still in the more severe path of the confrontation with the virus. So I think that this can be one of the points that refrains institutions or governments. In Spain, we have done that because we have ended the waves, but probably other countries will wait in a certain way that this is over or the first wave is over to present the respect at the public level.
All right, Professor Jimenez Hjort from the Autonomous University of Barcelona. Thank you so much, time, and thank you for sharing your research on death and mourning in times of a pandemic with us.
Thank you to you.
Well, now time for more of your questions. Over to our science correspondent, Derek Williams.
What's happening with the present flu season?
This is a really interesting question that made some headlines after a big Wall Street Journal article on the topic last week. Don't forget that when it's summertime here in the Northern Hemisphere, it's winter in the Southern Hemisphere. So for the last 5 months, there should have been a spike in the number of cases of influenza as flu season ramped up into full swing there. But according to the WHO, global flu levels have remained astonishingly low for this time of year in many countries south of the equator. In some places, they've dropped by 90% compared to average years. And actually, when you think about it, it probably shouldn't come as much of a surprise. Along with heavily restricted travel, all of the social distancing measures people have been observing to stop the spread of COVID-19 are ones that would also be effective at curbing the spread of flu. We've just never used them against the flu before on this kind of a scale.
Could SARS-CoV-2 combine with influenza viruses to create a new strain?
Usually, viruses evolve through a gradual process called antigenic drift. which sees them slowly mutate as changes occur in their genetic material over time and many replications. What you're talking about is a phenomenon known as antigenic shift, which describes abrupt, major changes that can occur, for example, in some flu viruses, when two different strains recombine inside a host to produce a much more deadly pathogen, apparently out of the blue. That's what we think, for example, occurred with the H1N1 flu virus that caused a pandemic back in 2009. Fortunately, antigenic shift that leads to highly infectious new pathogens seems to occur rarely, and we're pretty sure it only happens between very closely related pathogens. So some flu viruses recombine amongst themselves in this way, and there's some evidence that some coronaviruses might do it too, but the two different species won't recombine with each other to create some kind of superbug.
Now, before we start worrying about the next health threat, let's deal with the one at hand. For people in Hong Kong, this means no more dining in at restaurants. After a new upsurge in case numbers, restaurants have been ordered to halt dine-in service and offer takeaway meals instead. And while the threat is real, with views such as of Hong Kong Harbour, well, eating outdoors may not be the worst way to spend your lunch break, as you see here, certainly in times of a pandemic.